That's right. And if there's one thing to know about HIV, it's that once you get it, you're stuck with it forever. Or at least, that's what we've been told. In 2019, Excision BioTherapeutics became the first company to remove HIV genomes from non-human primates, generating a functional cure for HIV. Now, this is huge. Since the start of the global epidemic in 1981, 76 million people have become infected with it. 40 years later, HIV still remains a huge global public health issue, with 38 million people living with it worldwide. Up till this point, there have only been 2 cases of confirmed HIV cure, ever. Excision uses CRISPR gene editing technologies to cure viral infectious diseases, such as HIV. To sum up what it does, a Cas protein with an RNA strand embedded in it, called the guide RNA, is led to the region of the DNA that matches with that target RNA, at which point the protein makes a cut in the DNA. In essence, you can make edits or cuts to whatever part of the DNA you'd like, just by changing the guide RNA. But what makes Excision different from all the other companies out there also using CRISPR to edit genomes is their approach. With standard gene editing approaches, only single base cuts or small cleaves are executed. This greatly increases the probability for viral escape. In other words, you aren't able to fully cut out the virus's DNA, and thus, you aren't able to create a cure. What Excision does, however, is that instead of using just one guide RNA, they use 2 or more guide RNAs to cut out much larger sections of the embedded viral DNA, so that there's not enough to replicate or reproduce. The DNA is then joined back together through non-homologous end joining, meaning it doesn't need a sister chromatid as a template to repair itself. By making such a large deletion, there is extremely little probability of viral escape, making this treatment curative. 2 other great things about this approach. 1. By targeting non-human viral genomes, they minimize the chance of off-target cuts, which is when cuts are made at sites other than the intended target, leading to unwanted mutations. This makes this treatment a safe method to use. 2. This method only requires a one-time gene edit to remove the viral genome permanently, making it an efficient treatment as well. As we can see, the future of Excision is quite promising. Excision will enter phase 1 and 2 of human clinical trials this year, and they're also looking to use the same approach on other viruses that enter the host cell's nucleus. Seeing the astronomical advancements Excision has made so far with gene editing, we can remain hopeful and optimistic that Excision's technology and approach will make waves in the healthcare industry and bring much-needed therapies to millions in need across the world.